Chrissy. I'm going to be your nurse today performing your assessment. Can I check your ID? And can you let me know your name, date of birth, as well as how old you are?
Cheryl Reba. Date of birth is 8/9/56. Makes me 64.
Okay, do you have any allergies?
No.
Okay, so I'm going to get started with your respiratory assessment. So I'm going to just start by inspecting you. I'm not going to be touching you right now. So I can see that the patient's posture is erect. There's no signs of distress in her eyes. Her nose, mouth, and lips are normal. Her mucous membranes are also normal. Her neck, chest, and breathing is normal. Breathing is symmetric. And her ribs are moving normally as she inhales and exhales as well. So now I'm just going to, if you can lift up your arm. Okay, so her APT ratio is 1:2, which is good. And if I can see your hand, I'm just going to assess her capillary refill. It's less than 2 seconds, which is perfect. There is no clubbing with her nails either. So next I'm just going to palpate around your chest for any masses or crepitus. Just like let me know if you feel any pain. Do you feel any pain?
No.
Nope. Okay, great. And then I'm just gonna move along in the back, and I'm gonna perform tactile fremitus. So when I place my hands on your back, you're just going to say 99, and then I'm gonna do it 2 more times along your back, over your lung field. Can you say 99?
99.
Great. And again?
99.
Okay.
99.
Okay, great. So on her back, after performing tactile fremitus, the sounds, there was resonance. There was good resonance over the lungs, which is good. Next, I am going to then auscultate. Actually, no. First, I'm going to, before I auscultate, I'm going to percuss the back of her, the lung fields. Okay, so after doing that, the sound, there was resonance, which is what you're supposed to hear, over clear lungs. Now I'm going to auscultate. I'll start in the back with her posterior, the 6 spots. If you can, when I put my stethoscope on each spot, just take a deep breath, inhale, and then exhale. And again. And again. And again. Okay, again. And one more time on the back. Okay, great. So now I'm going to move on to the front, and I'm going to auscultate the 6 fields on the front. If you could do the same thing. And again. Okay, and I'm going to do the 3 sides on your right lateral side. If you can lift up your arm, I'm going to do the 3. Okay, great. And again. Okay. Okay. And I'm going to move on to the 2 lateral on the left side. Okay. Okay, great. So after auscultating on the front and on the posterior, the sounds were clear. There was no evidence of crackling, wheezing, rhonchi, or anything like that. So all normal findings as far as that goes. So next we are going to move on to the cardiac assessment. So I'm going to have you move to the bed or couch, and you can just, if you can, lay back. And I'm going to have you tilt your head like that so I can observe the jugular vein. and it is not protruding, so there is no sign of JVD. I am going to palpate. There's no masses there, and you can sit up. Get back to that seated position. And there was also no signs of thrills as well. So the first thing that I'm going to do next is auscultate. I'll auscultate first. But first I'm going to actually identify the spots that I'm going to be auscultating. So I have the aortic, which is on the right intercostal space, the pulmonic, which is the left intercostal space, Erb's point, which is on the third left intercostal space, the tricuspid, which is on the fourth intercostal space on the left side, and then the mitral, which is on the fifth intercostal space on the left side. I also can note her suprasternal notch as well as her angle of Louis here. So after palpating on her chest area to locate those points, there was no signs of thrills. And was there any tenderness as I was touching around? No? Okay, great. So now I'm going to listen. I'm going to first listen with my diaphragm to the aortic. Okay. Now I'm moving on to Erb's point. Great. And the tricuspid. And I'm going to move on to the mitral valve. Okay, great. So now I'm going to listen to it with the bell. To make sure there's no signs of murmurs. Okay. And I'm just gonna. Okay, great. So after auscultating, there were no signs of murmurs. Her heart rate was beating good, and I'm just going to get the apical pulse now. Okay, so we've done that for a minute, and her apical pulse was 65, which is good. The loudest sounds that I heard for the S1 is at the apex, and then S2 is heard loudest at the base of the heart. So next I'm going to do the abdominal assessment on you, so if you can turn onto your back. Okay, great. So assessing her stomach and her abdominal area, there is contour. The contour is good, I should say. Her stomach is symmetrical. I could see the breathing rising and falling, so normal movement of the stomach. Her skin color was normal. There was no scarring, no signs of minimal striae, no piercings, and no masses are noted. So now I'm going to auscultate. I'm going to auscultate the 4 quadrants of the abdominal area. Okay. Okay. Okay, great. So after auscultating the 4 regions or the 4 quadrants, her sounds were active. They weren't hypo or hyperactive. They were pretty normal. I did listen for, with my bell, I listened for friction rub, brutes, as well as any venous hums, and there was no presence of those. So now I'm just going to percuss around her liver, spleen, and her lungs to make sure those sound how they should. Okay, so those turned out good. Around her liver and spleen, it was dull and flat, which is what it should be. Her lungs were resonant. Her stomach, there was tympany, which is good. And there was no CVA tenderness while I was doing the percussions. Also during my assessment, during my initial inspection, there was little signs of peristalsis, as well as a little bit of pulsations, and her belly button or umbilicus was in its normal spot. So last I'm going to just palpate around, and you just had to let me know if you feel any pain. Any pain? Nope, no signs of pain, and there are no masses, and there's no sign after feeling around where her liver and her spleen would be, there is no sign of organomegaly. So you can sit up. And yeah, that is it for the assessment.